Imagine being trapped in darkness for 20 years. That's how Paul, a retired Marine, FBI agent, and a 51-year-old divorced father of three, described his battle with treatment-resistant depression. After trying countless medications and therapies without success, he volunteered for a clinical trial at Stanford using psilocybin-assisted therapy. In just one supervised session, something remarkable happened. The darkness began to lift. What the drug does, Paul explained, is to take you right to the most dark and the most light place. It was a blessing. I felt enormous relief. It gave me back hope. The numbers are staggering. Nearly 50 million American adults, that's 1 in 5, experienced mental illness in 2021. The lockdown period from COVID-19 alone added around 5 million new adults to that list. 25 million have been on antidepressants for at least 2 years, a 60% increase in less than a decade. But here's the kicker. For many, these treatments simply don't work. The STAR-D study, the largest antidepressant study ever conducted, found that remission rates dropped to just 10 to 20% after trying multiple medications. Before we get started, let's be crystal clear. We're discussing the medical use of psychedelic compounds in clinical settings, not for recreational use. Think less Woodstock and more Mayo Clinic. We're talking about carefully controlled, clinically administered compounds that are showing unprecedented results in treating conditions like PTSD, treatment-resistant depression, and severe anxiety. Clinical trials using compounds like psilocybin, MDMA, and ketamine are reporting success rates that would have seemed impossible just a few years ago. We're seeing 67% of PTSD patients no longer qualifying for the diagnosis after just 3 MDMA therapy sessions. We're seeing severe depression lifting in hours rather than weeks or months. This matters because mental health affects everything: our families, our workplaces, our communities. The economic burden of major depressive disorder alone is estimated at $326 billion annually. But beyond the numbers, this is about human suffering and hope. Welcome to Apprentice.io's Industry Insights. I'm Frank Maggiore, and today we're diving into what might be the most significant breakthrough in mental health treatment in over half a century: psychedelic medicine. We're going to explore how these treatments work, the rigorous science behind them, and the sophisticated manufacturing controls needed to bring them safely to patients. We'll look at both the extraordinary promise and the very real challenges of integrating psychedelic medicine into our healthcare system. We'll hear from researchers, clinicians, and patients. We'll examine the role of cloud-based manufacturing systems in ensuring these powerful compounds are produced safely and securely. And we'll tackle the burning question: how do we harness these treatments' potential while avoiding the pitfalls that led to crises like the opioid epidemic? This isn't just another story about a new drug or therapy. This is about potentially rewriting our understanding of how to heal the mind. And it's happening right now in labs and clinics across the country. Stay tuned. This is definitely going to be a trip through medical innovation, that is. Let's talk hard numbers and harsh realities. Right now, we're facing what could only be described as a mental health tsunami. Pre-pandemic, around 45 million American adults were dealing with mental illness. By 2021, that number jumped to nearly 50 million, and that's just diagnosed cases. But here's where it gets really concerning. Our current treatment toolbox is, well, let's just say it's showing its age. We've been using essentially the same antidepressants for 3 decades. As former NIMH Director Thomas Insel puts it, we have about 30 different antidepressants, 20 different antipsychotic drugs, and 7 different mood stabilizers, and almost none of them are more effective than what we had 30 years ago. Think about that. In the time we've gone from brick phones to smartphones that can power a small business, our primary mental health care treatments have barely changed. And the success rates? Well, they're not exactly inspiring. The largest study ever done on antidepressant effectiveness, that STAR-D trial I was talking about, found that remission rates dropped to just 10 to 20% after patients try multiple medications. Now let's talk about access to care, because these numbers are truly sobering. Around 1 in 4 adults with a mental illness reports being unable to receive the needed treatment. We're short around 6,400 mental health providers across the country, creating what we call mental health professional shortage areas. Basically, mental health deserts where people simply can't access the health care that they need. Emergency medical health services, that's another crisis entirely. On average, psychiatric patients wait in emergency rooms 3 times longer than other patients. Some wait days, yes, days for a psychiatric bed to open up. And let's talk costs, because this is where many people's mental health journey hits a brick wall. The average cost of a therapy session ranges from $100 to $200. Most Americans can't afford that weekly or even monthly. Even with insurance, many mental health providers don't accept it because the reimbursement rates are just so low. The stigma, it's still here, even in 2025. About 75% of people with mental health conditions report feeling shame about their diagnosis. In some communities, particularly communities of color, this stigma is even more pronounced. Only about 1/3 of Black adults who need mental health care actually receive it. The economic impact is staggering. Depression alone costs the U.S. economy about $326 billion annually. That's not just treatment costs, it's lost productivity, workplace absenteeism, and the ripple effects through families and entire communities. But perhaps the most heartbreaking statistic is this: the average time between someone first experiencing mental health symptoms and getting treatment is 11 years. 11 years of suffering, of trying to cope alone, of lives put on hold. This isn't just a healthcare crisis, it's a societal emergency, and it's why the search for new, more effective treatments isn't just important, it's absolutely crucial. Let's cut through the hype and look at what science actually tells us about therapeutic psychedelics. Since the 1950s, researchers have published over 36,000 papers on psychedelics, including nearly 500 randomized controlled trials, the gold standard in medical research. The results? They're frankly stunning. Let's break down some key findings from recent clinical trials. In studies of psilocybin therapy for cancer-related anxiety and depression, over 70% of participants showed significant improvement after just 2 sessions. That's not just feeling a little better, we're talking about profound, lasting changes in their mental health state. MDMA trials for PTSD, the numbers are even more impressive. In the world's first FDA Phase 3 trial, 67% of participants no longer qualified for a PTSD diagnosis after only 3 sessions. Compare that to traditional treatments where success rates hover around 30 to 40%. But here's what's really fascinating. These aren't just temporary fixes. We're seeing benefits lasting months, sometimes years from just a few sessions. One long-term follow-up study found that 60 to 80% of participants maintain significant improvements in depression and anxiety 4.5 years after treatment. Now let's talk dollars and cents, because this matters for healthcare implementation. A recent analysis showed that if just 1,000 people with PTSD were treated with MDMA-assisted therapy instead of traditional treatments, the healthcare system would save over $130 million over 30 years. That's not counting the broader economic benefits of having more people able to return to work and fully participate in society. But, and this is a big but, translating these results into widespread treatment isn't that simple. We're facing several significant barriers. First, there's the regulatory framework. Most of these compounds are still classified as Schedule I drugs, meaning they are considered to have no accepted medical use. The irony of having thousands of research papers showing medical benefits while maintaining this classification isn't lost on anyone. Second, we need infrastructure. These aren't treatments you can just pick up at your local pharmacy. They require specialized facilities, trained therapists, and robust safety protocols. Companies looking to enter into this space need sophisticated manufacturing and tracking systems. Think pharmaceutical-grade security combined with blockchain-level traceability. But here's the good news. Companies are already solving these challenges. We're seeing the development of specialized clinics, training programs for therapists, and advanced manufacturing facilities with state-of-the-art security systems. Major healthcare institutions like Johns Hopkins and Mount Sinai have established psychedelic research centers. The investment community is taking notice too. In the past few years, we've seen over $2 billion in commercial investment in psychedelic medicine. There are now over 50 publicly traded companies in this space, with a combined market cap north of $6 billion. Perhaps most importantly, public perception is shifting. Recent surveys show that 2/3 of Americans support making psychedelics available for medical use. Insurance companies are starting to look at coverage models, and several states have already passed legislation supporting psychedelic research or treatment programs. What we're seeing isn't just promising research, it's the foundation of a new paradigm in mental health treatment. One that could offer hope to millions who haven't found relief through traditional methods. Let's break down the major players in psychedelic medicine, starting with what researchers tell us about each compound. Psilocybin, the active compound in magic mushrooms, is leading the charge. In clinical trials for major depression, a single treatment showed a 71% response rate, with 54% of patients achieving complete remission at 4 weeks. For cancer patients dealing with anxiety and depression, the results are even more impressive. 70% showed lasting positive effects. The FDA has granted a breakthrough therapy status twice, recognizing its potential for treating both major depression and treatment-resistant depression. Ketamine's already making waves as the first psychedelic medicine to break through to mainstream treatment. While it's been used as an anesthetic since the 1970s, its potential for treating depression is revolutionary. What makes it unique? Speed. While traditional antidepressants take weeks to work, ketamine can lift severe depression within hours. Clinical trials show a response rate over 60% within 24 hours. There's already an FDA-approved nasal spray version, Spravato, specifically for treatment-resistant depression. MDMA, sometimes called ecstasy in its street form, is showing remarkable promise for PTSD treatment. In FDA Phase 3 trials, and folks, these are the gold standard of clinical research, 88% of participants saw a significant improvement after just 3 therapy sessions. 2/3 no longer met the criteria for PTSD at all. These results held steady in follow-ups months later. LSD, despite its controversial history, is making a comeback in research. Early studies from the 1950s and 60s showed promising results for treating alcoholism, with success rates around 59%. Modern research is now exploring its potential for anxiety and depression treatment, though we need more contemporary clinical trial studies. Ayahuasca, containing DMT, has been used traditionally in South America for centuries. Recent clinical trials show it can rapidly reduce symptoms of treatment-resistant depression within hours. One study found that 64% of participants experienced complete remission of depression symptoms. Mescaline, while studied less than the other compounds, show potential particularly for addiction treatment. The limited research we have suggests it might help with substance use disorders, though we need more rigorous clinical trials. Ibogaine is particularly interesting for addiction treatment. Clinical studies show it can significantly reduce opioid withdrawal symptoms and cravings, with some patients maintaining sobriety for months after a single treatment. However, it does carry cardiac risks that need careful monitoring. Now, let's talk about the challenges with each. Psilocybin and LSD treatments typically last 6 to 8 hours, requiring significant clinical resources. They can also temporarily increase anxiety during sessions, though this often leads to therapeutic breakthroughs when properly managed. Ketamine's effects are shorter, but it might require repeated treatments to maintain benefits. There are also concerns about potential abuse given its history as a party drug. MDMA can cause temporary increase in heart rate and blood pressure, requiring medical monitoring during sessions. However, serious adverse events in clinical settings are extremely rare. What's particularly exciting is that each compound seems to work through different mechanisms. Psilocybin appears to reset overactive brain networks. MDMA helps people process trauma by reducing fear response while increasing empathy. Ketamine rapidly forms new neural connections. The safety profiles in clinical settings are remarkably good. As Dr. David Nichols, a leading psychedelic researcher, notes, although there is a general public perception that psychedelic drugs are dangerous, from a physiological standpoint, they are in fact one of the safest known classes of CNS drugs. These aren't one-size-fits-all treatments. Each compound might be best suited for different conditions. The future might involve personalized treatment plans, matching specific compounds to individual patients and conditions. Getting any new drug through FDA approval is like running a marathon with hurdles. But when it comes to psychedelics, it's more like running that marathon with hurdles while juggling chainsaws. Let's quickly review the standard FDA approval process. Phase 1 tests safety in healthy volunteers. Phase 2 explores effectiveness and optimal dosing. And Phase 3 confirms the benefits in larger populations. Simple enough, right? But here's where it gets interesting with psychedelics. Being Schedule 1 substances means researchers need special DEA licenses just to handle them. Every gram must be meticulously tracked. Storage facilities need security systems that would make Fort Knox jealous. And that's before we even start the actual trials. Manufacturing clinical trial materials for psychedelics presents unique challenges. You need DEA-registered facilities, sophisticated track and trace systems, enhanced security protocols, specialized handling procedures to protect workers, and rigorous quality control to ensure consistent potency. But here's the real kicker. The traditional double-blind, placebo-controlled trial design, it's tricky when your treatment causes obvious psychedelic effects. How do you maintain the blind when participants definitely know if they got the real thing? Some researchers are getting creative. They're using active placebos that cause mild psychoactive effects or novel trial designs that focus more on measuring outcomes than maintaining perfect blinding. The FDA has shown flexibility here, recognizing these unique challenges. There's good news, though. The FDA has granted breakthrough therapy designation to several psychedelic treatments, including MDMA for PTSD and psilocybin for depression. This fast-tracks the review process and shows the FDA's willingness to adapt. To optimize the system moving forward, we need a streamlined DEA approval process for research, standardized protocols for manufacturing and handling, better integration of digital tracking systems, more efficient ways to measure long-term outcomes, and clearer pathways for therapist training and certification. The goal isn't to cut corners, it's to remove unnecessary obstacles while maintaining rigorous scientific standards. As one researcher put it, we're not trying to make it easier to approve psychedelics, we're trying to make it easier to properly study them. Let's dive into one of the most watched stories in psychedelic medicine, Lykos Therapeutics and their groundbreaking MDMA trials. For those keeping score at home, Lykos might sound unfamiliar. They recently rebranded from MAPS Public Benefit Corporation, bringing decades of MDMA research experience to the table. Their Phase 3 trials for MDMA-assisted therapy in PTSD patients produced some of the most remarkable results. After just 3 sessions, 67% of participants no longer qualified for a PTSD diagnosis, and 88% showed significant symptom reduction. These aren't just numbers, they represent potential life-changing outcomes for people who've struggled with traditional treatments. But in August 2024, they hit a speed bump. The FDA turned down their application for approval, requesting another Phase 3 trial. Why? The agency had concerns about the strength of the data and wanted more evidence about safety and efficacy. The FDA's main concerns centered around the need for larger patient populations in trials, questions about the durability of the treatment effects, importance of diverse patient demographics, the need for more robust safety monitoring, and clearer protocols for therapy standardization. Lykos isn't throwing in the towel. Far from it. They're currently in what they describe as productive discussions with the FDA, planning an independent third-party review of their existing Phase 3 data and designing an additional trial. Their commitment makes sense when you consider the potential impact. Current PTSD treatments often have success rates under 40%, while their MDMA therapy is showing nearly double that. What's particularly interesting is how this case highlights the unique challenges of psychedelic medicine trials. It's not just about the drug, it's about the entire therapeutic package. The FDA needs to be convinced not just of MDMA's efficacy, but about the reliability and reproducibility of the therapy protocol that goes with it. As of early 2025, Lykos continues to chart their path forward. Their experience is likely to set important precedents for other psychedelic medicines following in their footsteps, helping to establish the framework for how these innovative treatments can make it through the approval process. When you're manufacturing compounds powerful enough to alter consciousness, your control systems need to be absolutely bulletproof. This is where cloud-based manufacturing execution systems come into play, and they're a game changer for psychedelic medicine production. Think of MES as the central nervous system of modern pharmaceutical manufacturing, but for psychedelics, we need to kick it up several notches. We're talking about systems that track every microgram of material, from raw ingredient to final dose, with blockchain-level verification at every step. These systems need to integrate real-time inventory tracking, automated containment controls, environmental monitoring, personnel authentication, quality control testing, and compliance documentation. Let's talk about operator safety. Manufacturing psychedelics isn't like making aspirin. Even minimal exposure could affect the worker's consciousness. Modern MES systems coordinate with automated handling systems to create what we call closed processing environments. Operators never directly handle active compounds. Everything is managed through sealed systems with robotic handling and automated cleaning protocols. Security, that's where things get really interesting. We're implementing biometric access controls, AI-powered video surveillance, RFID tracking for all materials, weight-based inventory reconciliation, smart packaging with tamper-evident features, and real-time movement monitoring. One fascinating innovation is smart vaults that require multiple authenticated users for access, similar to nuclear launch code protocols. Every access is logged, every movement tracked, every deviation flagged instantly. For packaging and distribution, we're seeing new technologies like DNA tag materials for authenticity verification, smart labels with real-time location tracking, temperature-sensitive security seals, quantum dot marking systems, and blockchain-verified chain of custody. The MES coordinates all of this through a single, secure platform. If there's any deviation, say a weight discrepancy or an unauthorized access attempt, the system automatically triggers containment protocols and alerts security. But perhaps the most critical feature is the audit trail. Every action, every movement, every measurement is permanently recorded. We're talking about systems that can track a single dose from raw material to patient with zero gaps in the chain of custody. These aren't just nice-to-have features, they're essential for preventing diversion and maintaining public trust in psychedelic medicine. As one security expert put it, the controls need to be so tight that tampering isn't just difficult, it's impossible. The shadow of the opioid crisis looms large over any new class of powerful psychiatric medications. Let's be brutally honest, over 840,000 Americans have died from drug overdoses since 1999, many due to legally prescribed medications. We absolutely cannot let history repeat itself. But here's the crucial difference with psychedelics. They're not addictive in the way that opioids are. In fact, many show promise in treating addiction itself. Still, we need rock-solid safeguards. First, clinical trials must be beyond reproach. No rushing to market, no cutting corners. That's why the FDA's recent decision to require additional MDMA trials, while disappointing to some, is actually reassuring. We need to know exactly what works, with whom, and under what conditions. The barriers for psychedelic medicine are intentionally high because these compounds powerfully affect consciousness, the potential for psychological dependence exists, financial interests could push for overprescription, underground markets already exist, and proper administration requires specialized training. But here's the paradox. Making access too restrictive could drive desperate patients to dangerous underground alternatives. We're already seeing this with ketamine clinics popping up everywhere with varying levels of oversight and expertise. The solution? A balanced approach with multiple safeguards. Mandatory therapist certification programs, controlled dispensing environments, regular patient monitoring, clear treatment protocols, insurance coverage for legitimate use, and robust outcome tracking systems. We also need to learn from what worked in containing other powerful medications. For instance, certain cancer drugs require special certification for prescribing. Similar systems could work for psychedelic treatments. The goal isn't just to prevent abuse, it's to ensure these potentially life-saving treatments reach the people who need them the most, safely and effectively. As one researcher put it, we have a chance to do this right from the start. Let's not waste it. We stand at a remarkable crossroads in mental health treatment. After decades of stigma and prohibition, some of the most promising innovations in psychiatric medicine are emerging from compounds that have been hidden in plain sight for centuries. The numbers tell a compelling story. 70% remission rates for cancer-related anxiety, 67% of PTSD patients no longer qualifying for diagnosis, depression lifting in hours rather than weeks, addiction treatments showing unprecedented success. But numbers don't capture the human story. We're talking about veterans finding peace after decades of trauma, cancer patients facing their fears with newfound courage, people stepping out of the shadow of depression into the light of hope. The evidence is becoming impossible to ignore. Major institutions like Johns Hopkins, NYU, and Mount Sinai have all established psychiatric research centers. The FDA has granted multiple breakthrough therapy designations, and even insurance companies are starting to recognize the potential cost savings of these treatments. But this isn't about new treatments, it's about a new paradigm in mental health care, one that recognizes that sometimes the path to healing requires us to think differently, to challenge our assumptions about what medicine can be. To those suffering right now, help is coming. The wheels of medical progress turn slowly, but they are turning. These treatments are making their way through the system with unprecedented speed because they work, because they matter, because you matter. We're building something remarkable here, a future where mental health treatment doesn't mean years of trial and error, therapy that can produce profound change in just a few sessions. People don't have to choose between effectiveness and safety, and hope isn't just a word, but a reality. The stigma around mental health is finally crumbling. The stigma around these treatments is following suit. What matters isn't where these medicines come from, but where they can take us toward a future with less suffering, more understanding, and better options for everyone who needs help. This isn't just another chapter in medical history. It's a renaissance of how we understand and treat mental health. And it's happening right now in our lifetime. The science is solid, the systems are ready, the future is clear. Mental health treatment will never be the same, and that's exactly what we've been waiting for. Remember, it's not about getting high, it's about getting well, and that might make all the difference. In an industry where precision and compliance are paramount, Apprentice's Tempo platform offers a cutting-edge manufacturing execution system solution. It's cloud-based, mobile-first, operator-centric, with the most intuitive UI in the industry, making it perfect for today's dynamic pharmaceutical manufacturing environments and for the production of the world's most complex drug products. Whether you're working on groundbreaking cell and gene therapies, biologics, or small molecules, Tempo provides a fully validated MES system that's both powerful and easy to use. It streamlines your processes, ensures compliance, and adapts to your specific manufacturing needs. So get off of paper batch records and discover how Apprentice's Tempo Manufacturing Cloud can transform your operations by visiting us at apprentice.io. Attention industry professionals, revolutionize your manufacturing process with the Apprentice Tempo Manufacturing Cloud, a manufacturing execution system built to streamline your operations, boost efficiency, and ensure compliance all in one powerful platform. Experience the future of manufacturing with our free 30-day trial. Scan the QR code on your screen now to unlock a world of innovation. Don't just keep pace, set the tempo as an industry leader with Apprentice. That's all for Apprentice.io's Industry Insights. I'm Frank Maggiore. Thanks for listening. Be sure to like and subscribe. Hit the bell icons for notifications when new episodes drop. Please comment on if you have any additional topics you would like for me to cover in this space, and we'll see you next week for more Industry Insights.